Welcome to the lecture on the posterior shoulder girdle muscles. There are 8 muscles that act at the shoulder girdle. We have divided these muscles into the anterior muscles and the posterior muscles. We have already covered the anterior muscles during the anterior neck and shoulder lecture. Note that the anterior muscles, pectoralis minor, pectoralis major, serratus anterior, and subclavius, all act at the shoulder girdle. This would be a good time to try to review the muscles of the anterior shoulder girdle that are listed here, their attachments, and their actions that they have at the scapulothoracic interface. In this lecture, we're going to cover the posterior muscles that act at the shoulder girdle. These include the trapezius, rhomboid major and minor, levator scapulae, and latissimus dorsi. Note that all of these muscles act at the shoulder girdle, but most of them also have motions at the intervertebral joints or the glenohumeral joint. The trapezius is a rather large triangular-shaped muscle that we think about in 3 parts. This comes into play when we think about the actual movements that this muscle does. The attachments of the trapezius that I'd like you to know are the skull, the spinous processes of C7 through T12, the ligamentum nuchae, C1 through C6, lateral 1/3 of the clavicle, the acromion process, and the spine of the scapula. The trapezius muscle performs action at both the scapulothoracic interface and the cervical spine. The movements that occur at the scapulothoracic interface include elevation through the upper fibers, retraction through the middle and lower fibers, depression through the lower fibers, and upward rotation. Upward rotation is performed by all fibers, although during upward rotation, the middle fibers act mostly to stabilize the scapula. At the intervertebral joints, when the trapezius muscle contracts bilaterally, intervertebral joint extension occurs. When the muscle contracts unilaterally, the intervertebral motion produces side bending and rotation to the opposite side. As mentioned in an earlier lecture, the innervation to the trapezius is unique in that it gets its motor innervation and sensory innervation from different nerves. The motor innervation for the trapezius is through the accessory nerve, or the cranial nerve 11. The sensory portion of the trapezius comes through C3 and C4. Take this opportunity to label in your lecture notes the attachments that are highlighted with the arrows. Then go ahead and draw in the muscle by connecting the dots. How does your drawing compare to mine? Note the lower fibers of the trapezius do not attach to the medial border of the scapula or the inferior angle of the scapula. This tends to be a common mistake made by students. Latissimus dorsi. The attachments of the latissimus dorsi include the spinous processes of T7 through the sacrum via the thoracolumbar fascia, the iliac crest, the inferior angle of the scapula, the floor of the intertubercular groove, and the crest of the lesser tubercle of the humerus. The latissimus dorsi produces movement at both the scapulothoracic interface and the glenohumeral joint. The movements at the glenohumeral joint will be discussed in a later lecture. The movements at the scapulothoracic interface include depression and downward rotation. The innervation of latissimus dorsi is the thoracodorsal nerve. Take this opportunity to label the attachment sites of the latissimus dorsi and then draw in the muscle belly. How does your drawing compare to mine? As you can see here, there's a structure drawn in blue. This is actually representing the thoracolumbar fascia. The thoracolumbar fascia is a pliable sheet of fascia or membrane that actually covers the deep muscles of the back. It also serves, obviously, as an attachment site for the latissimus dorsi. Rhomboid major and rhomboid minor. We think of rhomboid major and rhomboid minor as one muscle. They are often referred to in the clinic as the rhomboids. That is because the rhomboid major and rhomboid minor produce the same movements at the scapular-thoracic interface and also are innervated by the same nerve. The attachments, however, differ slightly. The rhomboid major's attachments are the spinous processes of T2 through T5 and the medial border of the scapula from the root of the spine to the inferior angle of the scapula. Rhomboid minor's attachment sites are the spinous processes of C7 through T1 and the medial border of the scapula superior to the scapular spine. The movements of the rhomboids at the scapular-thoracic interface are elevation, retraction, down, and downward rotation. The nerve that innervates the rhomboids is the dorsal scapular nerve. Take this opportunity to label the attachment sites. Separate out the attachment sites of the rhomboid major and rhomboid minor, and then draw in the muscle bellies of rhomboid major and rhomboid minor using different colors. How does your drawing compare to mine? Levator scapulae. The attachments of levator scapulae are the transverse processes of C1 through C4 and the medial border and superior angle of the scapula. The levator scapulae has movement at both the scapular-thoracic interface and the intervertebral joints of the cervical spine. At the scapular-thoracic interface, levator scapulae performs elevation, whereas at the intervertebral joints of the cervical spine, it produces cervical extension with bilateral contraction, side bending, and rotation to the same side with unilateral contraction. The innervation of the levator scapulae is the dorsal scapular nerve. Again, take this opportunity to label the attachment sites and then draw in the muscle belly. How does your drawing compare to mine?